injecting yourself with an EpiPen by accident, that's a proper medical fail. You guys have probably all heard of EpiPen. So these are devices with a needle that inject adrenaline or epinephrine into the body, and people need that when they have severe allergic reactions, what we call anaphylactic reactions. Can be to various things, but most commonly things like peanuts or bee stings. And these are so severe that people need to take this treatment straight away. So if they came into contact with something, they'll get swelling around the throat, so their throat will close up and their blood pressure will drop as well. And this is life-threatening. That's why they need to carry the medication with them. And if you take adrenaline and you don't need it here, so you inject yourself by accident, you're gonna feel like, we all know what adrenaline feels like, right? So we get pumped up, it's our fight or flight hormone that gets released in times of stress, but we're gonna get all that kind of hormone activity just straight away. So we're gonna feel our heart rate going through the roof, our blood pressure going extremely high, and our blood vessels are gonna constrict as well. So we're gonna feel extremely dizzy and sick and unwell and kind of panicked. And that's why the person here is sort of laying back and needing to be monitored. One of the things to point out as well is where she's accidentally injected it into her thumb. That's not a good place to get adrenaline, because as we talked about, it constricts the blood vessels. And because there's not going to be a big collateral supply to the peripheral parts of your body, so the end parts of your body, then that can actually lead to tissue damage with that particular part of the body. So in this case, her thumb not getting enough blood supply. So all in all, I mean, I'm glad she's looking all right, but that is a pretty big medical fail.